The BA.2 subvariant of COVID-19 is now the dominant variant of coronavirus around the world. The question is, will we see a spike in cases from this new variant? Joining us now to talk about all of it is Dr. Dan Shirley, Medical Director of Infection Prevention at UW Health. We appreciate you taking the time, Doctor. Let's talk about this subvariant. Number one, what's the major concern? And number two, I think a lot of people are just to the point where they're saying another variant. Are we really going to go through this again? It really felt like we were on the other side of it this time. What are your feelings?
Yeah, I mean, that's a natural response, I think. There are kind of 2 points here. One is that in countries that maybe didn't have a huge Omicron surge or it was delayed, like some countries in Asia that are having a lot of COVID right now, are having this subvariant as the predominant thing. And even here in the United States, where we just did an Omicron surge, this variant is sort of replacing, let's say, the variant we dealt with. But the good news is that they're pretty similar, and a lot of the protection that you gain either by infection or vaccination works for this subvariant.
So I guess that, like you said, that is a bit of good news, because when it comes to that natural immunity, we here locally, we saw that surge in the numbers, beginning end of January, beginning of February. Does that help us? I mean, what you're saying is basically that helps us in this situation, because if so many of us, got that natural immunity just by contracting COVID in general, then maybe we can kind of steer clear from everyone panicking over this new subvariant.
Yeah, I think so. I mean, I hope so. Let's say we just know a lot more about what happens after vaccination as far as immunity. It still wanes, and therefore, as time goes on, that's kind of the question for people who are vaccinated about how long does this last, and is there other shots that are needed? Of course, the benefit of getting vaccinated is you can avoid the severe disease from any version of this COVID. But there is definitely some protection that people get from getting infected. It's just that it's unpredictable, and we still don't know how long it lasts. But right now, because we just did a surge and a lot of people are vaccinated, the combination of those things hopefully will protect us from a huge surge from this new subvariant.
That does make sense. Let's talk a little bit about hospitalizations. Who is in the hospital right now? What kind of patients? Is it those contracting these lesser variants, or I should say less severe variants? Is it the immunocompromised? Is it still those who are unvaccinated?
Yeah, it's the good news there is that it's just not as many people, and it's similar to the way it's been over the last several months as far as proportions. The people who are in the hospital for COVID, meaning we're treating them for COVID, and that's the primary problem, are predominantly not fully vaccinated, so either unvaccinated or just not boosted. But there are still some other people that we find have COVID that are here for another reason. But overall, just the rates of hospitalization overall are lower just because we have fewer cases.
And that's good, because obviously the hospitals at one point, I know that you guys were busting at the seams, staffing shortages, all of that. So we're glad things are continuing to progress in the right direction. Dr. Shirley, we appreciate you taking the time.
Thank you.